And Ohio seems to be turning a corner when it comes to the Omicron variant. Today, the Department of Health reported more than 12,000 new cases. That is a big drop from previous Thursdays where we saw 19 to 21,000 cases. Our positivity rate dropping too, down to 25.5%. Looking at our moving average graph here, you can see we are starting to see that downturn. One local school district is stopping contact tracing for COVID-19. Hilliard schools also cutting back on how often it updates case numbers. This is in response to new guidance from the state. New tonight, 10 TV's Kevin Landers explains the reasoning behind the change.
Angela Scheibel is a grandparent of 6 children. 4 of them attend Hilliard City Schools, a district that sent this letter to parents telling them, quote, "Our nursing team will no longer be sending classroom or building COVID-19 notification letters."
I think that the parents should be notified
Why is that so important?
because there's a lot of people getting it.
The district got the green light to stop contact tracing from the Ohio Department of Health Director, Dr. Bruce Vanderhoff. He said universal contact tracing became impractical.
There was virtually no school that was able to universally contact trace students all across their district.
I asked him if discontinuing the practice of contact tracing forces parents to guess which kids may be positive in their classroom.
We're not asking parents to guess where the exposure might be coming from. What we're advising parents is the exposure is everywhere.
That doesn't sit well with this grandparent.
I think the parents should be notified for anything in school.
Hilliard says it will continue to report COVID cases, but only on Fridays on the school's webpage. All other mitigation strategies like mask wearing and social distancing will remain in place.
We have strongly advised our schools to mask up. We've strongly advised them to ask their students to wear a mask at school.
The state says contact tracing going forward will only happen if there's an outbreak or cluster. Local health departments will be responsible for defining what that means, since 10 cases in a small school may be worse than 10 cases in a large school.
It was something that is literally just about everywhere. The most important steps that we can take are to focus on areas where we're seeing an unusual degree of activity, a cluster of cases, or a clear indications of a localized outbreak.
In Hilliard, Kevin Landers, 10 TV News.